But first, let's talk about the big three. One is DMG's printer. It's a comprehensive solution, meaning many printers in dentistry, they sell you and I a printer. And then separately from that printer, we're sort of charged with getting a wash and getting a cure unit. And, you know, the folks out there that do it that way, I'm not saying they're bad people or they have bad product, but nobody talks about that with a lot of other systems because it presents hidden cost. And number two, and I'm going to say this is from my own personal bias because I've always been clinical excellence first, dollars and cents second. That comes to, for everything that I do. I want great ROI, but for me, the number one thing that I want is clinical excellence. So I'm sharing this next piece from my own bias. More importantly, when you don't have a comprehensive solution, it presents questionable precision and accuracy. When you and I don't do what you and I rarely do, when we don't spend the time to make sure that all of those three components play well in the sandbox together, when we don't spend the time to read the IFU and know the IFUs to know. This is DMG system, it's plug and play. It's one system for us. It's a printer, a wash, and a cure that all work in unison. And there's nothing for us to guess at. We don't have to try to figure out, because we have a different printer, wash, and cure, we don't have to try to figure out how long we wash our hard tissue models versus our soft tissue models. We don't have to figure out how long we cure a surgical guide versus a hard model. It knows, it understands, it makes this process simple for us, which means precision and accuracy are on point. And we're going to talk more about that in a minute or two. So, a little example of surgical guides. Reason number two, it's intuitive. It's incredibly intuitive, in fact. And, you know, if I were in front of you, if we were in an in-person room together, I would literally just pick up and show you my smartphone, because it's like your smartphone. And ask yourself, whether you're a tech-driven person or you're not a tech-driven person, why do you love it? Because everything makes sense, right? Everything's in the right place. So I'll be honest with you, beyond the technology in my dental practice, I'm not a crazy like techie guy. So for me, when I got my very first iPhone and I picked it up and I saw an icon and I thought that icon should lead to my email because it just made sense, it was logical, it was intuitive, I'll be darned. It went to my email. You know, whatever icon I clicked to, it just went and it did it. So it's intuitive. It's my second big reason I like this. And I have to, you know, kind of pause here for a second and throw this in, because from a practice management standpoint, and this is a genuine question, again, to ask yourself, what happens in your practice when things are simple? What happens when they're easy for your team to learn and to execute? They get done, right? Those things get done, and they get done consistently.